Merhabalar, hoş geldiniz.
Hello, welcome. We will be speaking about the autonomic nervous system, and we will try to mention the correlation of the ANS with some psychiatric disorders. As an introduction, I will try to convey you a general information, and I will try to mention how the psychiatric disorders are developing. My colleagues will be speaking about the mood disorders. If you take a look to our subtitles, first of all I will convey the general knowledge of the autonomic nervous system, then functional measurement techniques of autonomic nervous system in psychiatry will be the second subtitle. The autonomic nervous system and emotions and their activation will be another subtitle. There are many studies going on with regards to emotion expression recognition, and with regards to the autonomic nervous dysfunction I will convey a couple of information, and I will touch upon the points of depression. Here you see the functional anatomy. ANS is comprised of parasympathetic nervous system and the sympathetic nervous system, and these two systems are antagonistically affecting each other, and they are creating a balance as a result of the environmental factors so that the human being can act in a more healthy and responsive way. The terminal neurons are present in the ganglions, and ganglions are in the outside of the ANS. The bodies of the preganglionic neurons are in the spinal cord or brainstem and its axons, synapses with the postganglionic cells, and the postganglionic neurons convey their axons to the target nerves. Thoracal and lumbar regions comprises the sympathetic nervous systems. Paravertebral ganglia from ganglion chain on both sides on the spinal cord, and they create this ganglion chain. Paraganglionic parasympathetic neurons are located in the sacral region of the spinal cord and the brain stem. Apart from the cranial nerves, they disseminate to the pelvic organs, and the parasympathetic nervous system is there. And the 10th region is also innerving those nerves. If we count the innerved regions of the parasympathetic nervous system, the muscles, atria in the heart, pituitary glands, intraocular muscles, reproductive organs, coronary arteries, excluding the coronary and the brain vessels, and all the vessels are not innerved by the parasympathetic nervous system. Excitation in the ANS is going through the effector organ, through the chemical messengers, as the chemical messengers both in the sympathetic nervous system and parasympathetic nervous system, acetylcholine is present and noradrenergic discharge is taking place, and in the parasympathetic nervous system acetylcholine is being discharged. As I mentioned before, parasympathetic and the sympathetic systems are antagonistic to each other. Many of the inner organs are affected by these two systems. For example, the excitation of the sympathetic nerves decreases the motility, and it leads to contraction, but the parasympathetic system does the reverse. It reduces the heart flow, it constricts the bronchi, and in this chart you'll see the methods that we are using for psychiatric disorders. We evaluate the pupils in the radial muscle of the iris through adrenergic stimulation. Metiasis is present, and with reverse coniosis will be present, and the heart rates will be increasing. With the cholinergic stimulation, the heart rate will be reduced. I will speak about those issues in the upcoming slides. The premotor muscles of the skin will be affected, and it might be evaluated with the skin conductivity as a result of the construction in the premotor muscles. Another exciting topic is the sympathetic activation and the amylase release in the saliva glands. Heart rate variability, myocard performance measurements, blood pressure, skin conductivity response, and pupil size and changes are evaluated most commonly. These are the charts that we can make use of. For cardiac autonomic function, we generally prefer to use HRV. Indeed, it provides a reliable index of cardiac autonomic function, and it protects against many pathologies. Lower parasympathetic input to the sinoatrial node predicts sudden and non-sudden cardiac death. The reduction in HRV are strongly associated with the higher incidence of the first cardiac events in patients without known cardiovascular disease. So this system will protect the heart health, and HRV, if it is high, then it will be protective for the heart health. If you have low HRV, then it is much probable for you to have cardiac diseases. You can evaluate HRV with the ECG by using pulse oximeter or Holter cardiography. RSA might be taken a look. RMSSD, SDNN, and PNSN might be used as different methods, and it was used in many different studies so far. Pork's polyvagal theory is used for the ANS changes, and my colleague will be speaking about those theories in detail later on. According to this theory, the ANS is indeed useful for the social inclusion and the social interaction. An important aspect of this theory is that it is bidirectional. First, it tries to evaluate the correlation between the behaviors and also the brain. The engagement with the environment will be much more easier. If someone is under threat, the vagal tonus will be inhibited, and in order to survive, the necessary response will be triggered. When there is no threat, then the social behavior and homeostatic functions will be used. The vagal brake will be used, and that will indeed reduce the heart rate. We cannot differentiate between the CNS and ANS because ANS is functioning under the control of the CNS. The brainstem amygdala is controlling the ANS, but in the central nervous system, these regions' functions should be evaluated, so it will be much more, of course, invasive and much more expensive with comparison to the ANS neuromonitorization. That's why ANS neuromonitorization is much easier, is much more cost-effective, and it is much more less sensitive to artifacts. How the ANS is impacted on different emotions. Different emotions might lead to specific responses, but the different presentation of the same emotions will lead to different responses of the ANS. I'm sure you cannot see this, but this is shown in order, this might be simplified based on the basic emotions. For fear and anxiety, a similar ANS activation is present, heart rate increased, HRV reduced, skin conductivity increased, adrenergic and cholinergic systems and the receptors will be activated, and the vagal system will be inactivated. So it's a sympathetic discharge. Apart from that, What can strike our attention? There is two types of sadness, one of them in which the crying is present and the other one in which crying is not present. If the crying is present, the heart rate will be increasing. If there is no crying, the heart rate will be reduced and the HRV will be reduced. If it is an expected and acute sadness, then the ANS system will be affected by that. If the sadness is expected, HRV will be reduced. For acute sadness, the HRV will be increased or will be staying the same. The emotions which is decreasing the heart rate are the passive emotions, and the vagal system will be present. Let's take a look to the HRV reduction emotions. Disgust, dread, sadness without crying, and acute sadness are among those passive emotions. The emotions which are increasing the heart rate might be seen in both negative emotions and positive emotions. For example, fear, anger, anxiety, and disgust because of the contamination might be present. One of the disgust might increase the heart rate and the other one might decrease it. Fear and shame, sadness and crying will increase the heart rate, but of course happiness might increase the heart rate as well. That's why we cannot make our classification monodimensional. We said that parasympathetic and sympathetic activation is present in those emotions, but they are not unidirectional. For example, since the activations are the result of the tests, these tests might indeed have an impact on the emotions of the person who is being tested. Even the temperature, environmental temperature, might have an impact on their emotions. Anger might be present in one person and it might be the anxiety in another person. As a result, in an anger in which the avoidance is dominant, then the heart rate will be reduced. We have spoken about the impacts of the disgust so far. With regards to emotion recognition, there has been many studies, and there are two theories defined, polyvagal theory and the neurovisceral integration theory. My colleague will be speaking about the polyvagal theory. For the neurovisceral integration model, a couple of neural structure is present for the emotion recognition. It is not a single function, but the functions which are interacting with each other is indeed recognizing those emotions. Prefrontal cortex is having an impact on the HRV, and it is also having an impact on the social cognition through different pathways. Through local cereolus and also through the hippocampus, it will have a huge effect on the social pathways, and the social cognition will be interacted with the HRV. An efficient cardiac control facilitates more flexible engagement with the environment and more efficient emotion regulation. There has been many studies for oxytocin. It is said that it is increasing both the HRV and also the emotion recognition. There is a direct or indirect relation between the HRV and oxytocin. And in addition to that, the alpha amylase as a non-invasive biomarker might be used. In the early 1970s, it was started to be studied as a response to certain situations. It was found out that the salivary alpha amylase increased. Negative stimulants were given to those indeed test population, and also the mothers were evaluated when their kids under stress. Verbal tests and the academic tests were conducted. In different situations that I have just mentioned to you, salivary alpha amylase increased. In the adolescents, through a stress test, the increase in the saliva alpha amylase increased. There is a significant difference between the resting time and this in the period under the stress. The chronic stress might also increase the SAA, saliva alpha amylase. Especially in young women, the saliva alpha amylase is correlated with the depression. Also, it is correlated with the asthma kids. And it is correlated with the plasma catecholamines. In some of the studies, plasma catecholamines were calculated, and there has been a positive correlation. In psychiatric disorders, we use HRV more commonly, and in many of the psychiatric disorders, HRV is being tested, and HRV is found out to be low in all of those disorders like depression, schizophrenia, anxiety disorder, and substance abuse. Can we modify the HRV? Because people with such disease and disorders will be much more inclined to obesity, their nutritional habits, the usage of alcohol or smoking will definitely have an impact on the heart health, and that's why it should also be questioned before the psychiatric disorders. Here, HRV is reduced the most in psychosis. Of course, it is low in all of them, but it is indeed the least in psychosis. There is also another term which is called cardiac autonomic valence. The juvenile group has been evaluated in terms of their relationship with the depression. The mean age is 16, between the 14 to 21-year-old in a randomized control study. Cardiac autonomic balance is calculated with the formula that you can see on the slide. A couple of tests have been implemented. Sad movies were exposed. Shaking hands test was done, and the puzzles which cannot be solved were given to the test samples. The cardiac autonomic balance increased on the verge of parasympathetic activation, so the balance was impaired, especially when they couldn't solve the puzzles. When we take a look to the effects of the antidepressants on the HRV, TCA is reducing the HRV. For clozapine, we have such a similar data. There is no significant effect of atypical and typical antidepressants on the HRV. Although metrazapine and nefrazodone is treating the depression, it is not changing the HRV. If you take a look to the correlation between skin conductance and depression, we have spoken about the role of the skin conductivity. In a study in the anxiety group, depression group, and comorbid groups have been evaluated. Different stimulants were given to them, and the skin conductivity response was evaluated. The skin conductivity response significantly increased even in the healthy population the moment that they see fear, and this was the same issue for the unhealthy population. Pupillometry will be the last part of my presentation, and I will conclude my presentation. Pupillometry is a quick, painless, and non-invasive process. The assessment of the pupil response to light stimulation and its dilation is used in the clinical setting for detecting optic nerve dysfunction, diagnosing certain drug effects. The use of pupillometry in psychology and psychiatry has a lower profile, stemming from initial forays in the 1960s as a measure of effect and cognition. As the cognitive burden increases, the pupil will be dilated. When we take a look to the brain influences on the pupil, amygdala and limbic brain regions, dorsolateral prefrontal cortex, the region which is responsible for the executive functions, anterior cingulate cortex, locus coeruleus and noradrenergic system will be correlated with the pupil. If we continue speaking on the light of the previous information, selective attention and executive functions and their correlations with the pupil are quite crystal clear, and we know that the pupils will be dilated if there is a cognitive deficit. Another causality might be found out, especially in the depressed people. They will do much more mistakes in a cognitive test, but in addition to that, a rumination will be an added cognitive burden in such patient population. As a result, the pupil dilatation will be much more higher in that group. Thank you very much for your patience.